Welcome back to a special edition of 13 News at 7. A conversation around the opioid epidemic, a catastrophic crisis that has taken a hold of our tri-state area. And one of the ways that health experts are actually able to combat opioid overdoses is by using something called naloxone. And many of the people on our panel tonight will tell you that naloxone does save lives if administered in a timely manner. But naloxone can effectively reverse respiratory depression that's caused by overdosing on opioids or opiates. Area emergency medical agencies administered over 4,000 doses of naloxone just last year alone, prompting many to ask, is the reversal agent helping or is it hindering the fight against drug addiction? We want to start with our panel now, and I want to start with you, Tammy, as the clinical manager for the emergency room at St. Mary's. What are you seeing now that naloxone has been introduced? Is it helping or is it hindering?
It is helping because people are administered the drug in the community. Many times you have to overdose several times and be revived before you actually come to help, to ask for help. They'll come to the emergency room with EMS. They may have given them the naloxone, and we may have to administer more depending on how much drug they've had. We may reverse the drug, they may leave. They may stay for treatment. It just depends on where they are, and at that point you have to be prepared to recover. You have to want to recover. You have to be in a place that you can recover, that there's support systems. Huntington has some of the best support systems in the nation. So, but saying that, you have to understand that naloxone is not something that just makes the problem prolong and you have to overdose and it's giving them another time to overdose. What it allows them is another chance at life. And sometimes it could be 7 or 8 times, and that's someone's husband, someone's child, someone's wife, someone's grandmother, someone's aunt. That person is someone to someone else, and someone loves them. And we have to give them that chance medically to come to recovery.
And do they actually, when you do see a patient and they do need naloxone, is there an option for them to immediately get some sort of treatment to help with their addiction, or how does that work in the emergency room?
We have several resources. We use Prestera a lot. We have peer counselors that will come and meet them. They will, if nothing else, leave them a card, because sometimes they're not ready for treatment at that point, but they have that contact. So when they are ready for treatment, they can get a hold of somebody 24/7. We have processes in place through our urgent care. When a bed opens up, that they are contacted through the many different services that are offered through the community, and they'll come for a medical clearance, and then they go straight to recovery. So the bed is available and they can immediately move to recovery.
Let's over and check in with my co-anchor, Patrick. I know you've also been checking online. We have some questions coming in from there as well.
We do. We have a lot of social media presence, a lot of people asking questions. And one of the questions is for our panelists tonight from Jenny W. from Facebook. My question is why they give them free needles, a place to do the drug, and the medicine to bring them back if they overdose. I think it's just insane.
I could understand the community's thoughts on that. The needle exchange. The needle exchange is so they are not contacting other diseases such as hepatitis. Hepatitis is a huge outbreak with drug abusers. So if they have clean needles, that's one less disease that they can contract. HIV is another one that they're trying to combat with the clean needle exchange. Knowing that these people will only use clean needles will help prevent other issues that could cause reoccurring problems. Also, many times we have to pull addicts out of cars at the emergency room. Sometimes if they have clean needles, there's not needles sitting around, or that patient doesn't have a hepatitis that could expose an emergency nurse to or EMS if they're at the scene trying to revive the patient.
And Brad, what are your thoughts on that? I know that you deal in substance abuse therapy.
Well, it's based on the last two things that you were talking about. Like, I'm curious how anybody could look at naloxone and what it does, and how somebody could say that's a bad thing. I mean, it's one injection saves a life. Like I don't understand how that could be viewed as a negative. And I'm sure a lot of people will say that needle exchanges or providing a safe place to use is a bad thing. I think you got to be realistic about a problem of this magnitude. People are going to abuse drugs. And sometimes it's about treatment, sometimes it's about true success, sometimes it's about harm reduction. You know, an approach of harm reduction gives someone the opportunity to keep experiencing these consequences so that they will hopefully be willing to implement the changes necessary to experience a meaningful recovery.
And what are your thoughts on that too, Tim?
We work directly with the harm reduction program, both in Charleston and Huntington. I think it's important that people understand people aren't walking in and handing in 3 needles and getting 3 needles and walking back out. We have recovery coaches. We have folks from the recovery community that are there that sit down and talk to these folks. We give them options for treatment. We have medical staff that take care of any open sores or wounds they might have. When we first started the needle exchange program, 33% of the people coming in said they were sharing needles. At our last needle exchange, the survey was down to less than 8. So when we look at harm reduction, these are needles that aren't being dropped in our alleys, aren't being dropped in our playgrounds, aren't being dropped in our streets. So we're protecting the community at large so someone's not stepping on it, reaching in a trash can and getting pricked. So we're providing that service and that link from that individual who may have a drug addiction to Prestera, Recovery Point, Her Place, and other services. And we're having about 30 to 40% of these people that are taking that next step and seeking a treatment option.
Thank you, Tim. And Patrick, I know you also had another question.
This is from a member of our audience tonight to any member of the panel. With all the discussion across the country about legalizing marijuana, what is the view of the panel about it being a gateway drug? Is this trend toward legalization something we should be fighting?
JD, I know that you actually work with a lot of people through Celebrate Recovery, and what are your thoughts on that? Is that a gateway drug when you see people dealing with addiction?
Well, I think it can be because a lot of people start using something because they have a pain inside. Maybe it's not a back pain, but maybe it's a hurt. Maybe they were abused as a child. Maybe they've suffered from depression, this, that, or the other. And so I think marijuana can be something that someone uses to dull the pain. And then, of course, there's a myriad of other things, and not just opioids, but gambling and alcohol, and that's why at Celebrate Recovery we say that we are here for any hurt, habit, or hang-up, and that would include marijuana and anything else that we would use to try to dull the pain or to numb the pain. But
So you're saying anything can be an addiction if you don't actually treat the root cause of addiction?
Sex is a wonderful thing. It can be an addiction, though, and it can be abused just like anything else. So that's why we find that with Jesus as our higher power, it's a 12-step group, but we find that we need more than just ourselves in order to deal with this pain. And we as a group and with our higher power are able to get through that without having to go to some sort of drug, be it marijuana, opioids, or any other substance abuse.
We'll come back and touch on that a bit more as well. But when we come back, we also want to talk about some of the tiniest victims we touched on a little bit earlier. And as I was sharing stories this month in our States of Addiction reports, those were some of the very hardest for me to share. We've been talking about states of addiction, but we're also going to talk about the international news that is now being shared about our region. And we're also going to talk to one of our founders of Lily's Place about what's being done to help our tiniest of victims. So we come back, stay with us.
The epidemic of addiction is not a West Virginia problem. It's a national problem. And I think that we just are tending to get a lot more of the attention right now.
We will return to a town hall meeting, States of Addiction, Fighting the Opioid Epidemic.